Hello, is that Mrs. Smith? Oh, hello, Mrs. Smith. My name's Dr. Val Jones. I'm calling from St George's Hospital. Are you okay to talk on the phone at the moment? Okay. So I'm just ringing you to get a little bit more information about your husband, Harry. As you know, he's been rushed to St George's Hospital this morning, hasn't he? The ambulance team were worried that he might have had a stroke. We're just having a look at him at the moment, and he's going to be going off for some scans. But I just wanted to check, were you with your husband this morning? Okay, so was he all right when he first got up? Right, so he came downstairs and made breakfast, made a cup of tea, and then what happened? Okay, so he then just fell to the floor and his right side was weak and he couldn't speak. Okay, and you did absolutely the right thing, because you called the ambulance straight away, didn't you, and got him into us, and we're just having a look at him at the moment. I just wanted, if I may, to just clarify a few things with you, and I apologise if I sound like I'm rushing you. It's just that we do like to get people assessed very quickly in order to see if there are any treatments that we can give them. Can I just check with you, the ambulance crew told me that Harry has a background of high blood pressure and diabetes, is that right? Do you know if he takes any medication for those conditions? Okay, and has he got any other serious health problems in the past that I haven't mentioned there? Okay, any background of any heart problems or irregular heart rhythms? No, okay. And does Harry smoke? Okay, and does he drink much alcohol? Okay, so you've told me that he's on bisoprolol and he also takes metformin. Is he on any blood thinners at all? Any medication like aspirin or warfarin? No, okay. And is Harry allergic to any medication? Okay. And do you happen to know what he weighs? Okay, oh, that's really helpful, thank you. Okay, and is Harry normally pretty fit and well? Okay, good. So he'd be able to go out to the shops on his own. Yeah, oh, he drives. Oh, and he plays golf 3 times a week. Oh, he's... And I just want to ask you a few standard questions about his health recently. Has he ever had any bleeding into the brain? Okay, and has he had any strokes or head injuries in the last 3 months? And you've told me he's not on any blood thinners, haven't you? Has he had any operations or biopsies or anything like that in the last few weeks or months? Okay, and has he ever had any bleeding from his tummy or his bowel that you know about? Okay, and has there been any bleeding from anywhere else recently that you know about? Okay. Okay, that's really helpful. The reason I'm asking is, looking at Harry on first assessment, it does look like he's having a really significant stroke. He can't move his right side at all and he's not able to speak to us. So I'm very worried that he's having a very significant stroke here. So we're just going to finish assessing him and then we're taking him for a brain scan in order to see what sort of stroke we think he might have had and whether he's suitable for any of our treatments that we have available. There are a couple of different types of strokes, and if he has had a stroke that's caused by a blockage in the brain, then I think as long as his brain scan and his blood pressure is suitable, then I think he may be in a position to benefit from our clot busting treatment. So this is a treatment that we give as an injection to people, which in about 1/3 of people can help to make them better than they would have been without treatment, and a smaller number of people, maybe 10% of them, will make a very good recovery as a result of the treatment. It can cause some problems with bleeding. A very small number of people might have some very serious bleeding, and 1 or 2 people out of 100 might die as a result of bleeding in the brain. That risk of bleeding is very small. Looking at your husband at the moment, if he's got the type of stroke that's caused by a blood clot, I really think that we should be giving him clot busting treatment to try and give him his best possible chance of recovery. Now, he's not obviously in a position for me to explain that to him, so I will make that decision, but do you have any reason to think that he wouldn't want me to go ahead with that treatment? No, you're absolutely right. Most people obviously want us to do absolutely everything we can with something as serious as this. Okay, so I need to go off to the CT scanner and see what's happening. I will come back to you and update you on the results of the scan and what we're doing. Is this the best number to get you on? Okay, now what I'd like you to do is I'd like you to stay near this phone so that I will be able to get hold of you if I need any other information, and also so I can update you on what we find looking at the scan and what we're planning to do with Harry. Is that okay? Okay. Is there anything you want to ask me at the moment? Okay, I'll speak to you again as soon as I possibly can. Okay then, bye-bye.